Welcome to the Rising Entrepreneurs Podcast, where we feature top founders and entrepreneurs and their journey. Now, let's get started with the show.
Dr. Jeremy Weiss here, founder of InspiredInsider.com, where I talk with inspirational entrepreneurs and leaders. Today is no different. I have Dr. Kristin Oja of Stat Wellness. And before I formally introduce Dr. Kristin, I want to mention other episodes people should check out of the podcast. You know, Dr. Kristin, both of us geek out on health-related topics. I had Dr. Scott Gray talked about the power of regenerative medicine. He's got clinics across the U.S., so check that episode out. I have some of my favorite products on here. So I had the founder of Wild Tonic kombucha. I love kombucha. That was an amazing episode. I had the founder of Truth Bar, which is a bar that has a lot of probiotics in it. Rusty Jones, co-founder of Hello Water. Also, we were talking about supplements. Roy Krebs started Natural Stacks, and he talked about his journey of growing that supplement company. So check that out. And there's so many great healthcare ones. Dr. Michael Fossil talked about telomerase therapy and longevity. He's an MD, PhD, MD from Stanford, taught at Michigan State, pretty smart dude. And Pete Cunningham is also, from the marketing side of things, CEO of Evolve Healthcare Marketing. He basically helps grow clinics by patient acquisition for chains of clinics. So check those episodes out. Lots of good stuff on InspiredInsider.com. This episode is brought to you by Rise 25. At Rise 25, we help businesses give to and connect to their Dream 100 relationships and partnerships. And how do we do that? We actually help you run your podcast. We're an easy button to launch and run your podcast. For me, Dr. Kristin, you met my business partner, John Corcoran. The number one thing in my life is relationships. I'm always looking at ways to give to my best relationships. I found no better way to do that than to profile the people and companies I most admire on this planet and profile them and shout from the rooftops, and everyone can learn what they're working on. So if you've thought about podcasting, you should. If you have questions, go to rise25.com and learn more. I'm excited to introduce today's guest, Dr. Kristin Oja, and she's the CEO and founder of Stat Wellness, and it's a one-stop wellness shop in Atlanta and Roswell, and growing from there. By the time you listen to this, they may have 3-4 more locations, and they focus on both functional medicine and movement. And she's an entrepreneur, nurse practitioner. Most impressive, I don't know how you do this, she's superwoman, mom of 2 right now, under 2, and her mission is to transform healthcare, putting the emphasis back on health, one patient at a time. So, Dr. Kristin, thanks for joining me.
Thank you so much for having me on here. And I think you just gave me a lot of listening while I run this week. I look forward to hearing those podcasts.
So tell us about Stat Wellness and what you do.
So we opened in 2019, so right before the pandemic. And at our 1-year party, I found out I was pregnant with baby number 1. So you can imagine opening in 2019, having 2 kids and doing a pandemic. Life has been crazy the past few years. January will be our 4th year open, but we started as the nation's first, as you mentioned, medicine and movement practice. And my big goal with starting Stat Wellness is to really build relationships with my patients outside of their once a year, twice a year medical visit. So under our roof, we have health coaches, we have dietitians, we have physical therapists, we have personal trainers, we do IV therapy, we do sick visits, we do well visits. So, we really get a lot of these touch points with our patients throughout the year. And we do a la carte and we do memberships. And our a la carte is just pay as you go. So we have some patients that just come in when they need us. And our bread and butter is our memberships. And so our memberships are based on a 1-year time period. And our goal is that we really want you to look at your health as a journey and a marathon and not a sprint. We never want to put false, expectations with our patients that hey, it's going to be 2 visits and you're going to be the best version of yourself. Our goal is we want these little by little, a little becomes a lot changes that are going to make you the best version of yourself over time. So that's kind of a little bit about us. And we want to stay, our big mission too, is to really stay, I know the word affordable is relative, but we want it to be something that is accessible to the masses. because there's a lot of great concierge providers out there, but some people can't afford that. And then primary care, we know those visits are less than 7 minutes with your healthcare provider. And you cannot get through a whole health timeline in a 7 to 15-minute period. So our, new patients are 1 hour long with a provider, not, a nurse working you up and then the provider coming in. Like, we are with you for an hour and we start at your birth. We want to know, are you a vaginal delivery or a C-section? What was your mom's health like when she was pregnant? Was she going through a traumatic divorce while she was pregnant? What was your upbringing like? What was your diet like at a young age? How many antibiotics were you on? These are the things that we ask and want to know in our visits, because that's how we get to know you. And that's how we start to uncover what some of the root causes to your imbalances are.
I want to talk about memberships and how you came up with this model, but I do want to talk about your background. How'd you get into this?
So it actually started as a personal trainer, and I just was going to be a personal trainer for the rest of my life. I loved motivating, encouraging, cheering my patients or clients on at the time. And my parents were like, Kristin, you need a degree. Like, just go to school and get a degree. And everybody told me, do nursing. You can always find a job in nursing. So I became a nurse in the ER and actually loved it because I got 13 miles in a shift. I'm a personal trainer. I'm really into my steps, and I got my Fitbit on and I'm tracking everything. And I love the adrenaline. I'm an adrenaline junkie. But what we were doing was we were treating and treating in the ER, right? We're getting them stable and sending them home and having them follow up with their primary care. And I called it the brown bag. People came into the ER with this brown bag on their chest on a gurney. And in their brown bag was 20 pills that they had no idea why they were taking each one of those medicines. And at the time I was a nurse, so I was responsible for lining up all of their medications, putting them all into their chart, asking them why they were taking each thing. And my patient was like, I don't know, my cardiologist prescribes that. My pulmonologist prescribes that. My endocrinologist prescribes that. My gastroenterologist prescribes that. And as you can see, what in the world is going on? Why are we on these 20 pills? Who's managing your care and uncovering what is the root cause of these things? So I quickly realized, as much as I loved the adrenaline, as much as I loved the steps, I needed to become a nurse practitioner to be able to sit down with my patients and actually make recommendations on their health journey. So I became a nurse practitioner, ended up doing great through my program, ended up getting a scholarship where they paid for me to get my doctorate. So then I went in and studied. My whole dissertation was on gut health. So I, had 100 patients in my study, and I looked at functional gastrointestinal disorders. So those of you guys that don't know what those are, they're like, hey, everything is fine. We did colonoscopies, endoscopies, blood work. Everything is fine. We don't know why you have these symptoms that you have. Here's a medication to manage your constipation, your diarrhea, your heartburn. And I put my patients in an 8-week study. And all I didn't even change their diet, which I think is so critical. I didn't even change their diet because that's a hard thing to, make sure we're being very consistent with. So all I did was put them on probiotics, digestive enzymes, and glutamine for 8 weeks. I did nothing else. That was it. And 88% of my patients had statistically significant improvements in their digestive symptoms, which makes you know that there is a cellular component of what's going on. There is a physiological component to IBS. This is not just in our head, right? So, and then from there, I realized again, I'm seeing these patients in integrative and functional medicine, but I'm seeing them for 30 minutes twice a year. Am I really making a difference? And so I started going back into my mind, like, now I'm doing exactly what I want to do, but am I really transforming my patient's life? I want to see them more often. How do I see my patients more often? I put a gym into my medical practice. Now you're coming in and you're moving and you're exercising, and you have unlimited health coaching in this membership. So now I can see you multiple times coming in the door. We can do some of our patients are like, I just need a 15-minute health coaching phone call on my way to work. I'm falling off the grid and I need the accountability. And that's why our membership was created.
I love it. I want to talk about the membership, but you're on, talking about gut health and supplements. What supplements do you recommend or do you take?
Yeah. So I think there's a few things. We tend to not put everybody on the same protocol for supplements. We are very individualized and we customize every single treatment plan, as much as my providers probably hate that because it involves a lot of free text and, making a new plan for every single person that walks in the door. And we check labs. We're very data driven. So when I make a recommendation of what you need, it is based on your actual lab results. And then we want to follow up typically at 3 months and recheck those same lab results and make sure we're having improvements. But in general, what do I find that so many of my patients are deficient in? Vitamin D, across the board, so many of my patients are deficient in vitamin D. We know about 90% of people have suboptimal magnesium. So vitamin D, magnesium, those are really big things. We check a lot of omega-3 fatty acid ratios. And, on a standard American diet, our omega-6s become really imbalanced with our omega-3s, and that drives inflammation. So vitamin D, magnesium, a good fish oil, those are typically things that a lot of our patients need. And then outside of that, it's very, individualized. Do we need probiotics? Our goal is not to take a probiotic the rest of your life. As much as I love probiotics, our goal is to get a diet rich in fiber and prebiotics to feed the good bacteria we have in our gut. So, to us, you're supplementing a healthy lifestyle, and we want to put lifestyle first above any other supplement.
What are some foods, Dr. Kristin, that are high in what people should consume for prebiotics?
Prebiotics. So there's so many different foods. Basically, foods that are rich in fiber are going to have prebiotics. So even basic things like ground flaxseed, throwing that into a smoothie, throwing it into your morning oatmeal, chia seeds, asparagus, leeks, green banana powder actually is a really great prebiotic, chicory root, inulin. There's lots of ways of getting this. And then we even look casting a wider net, things like avocado. A lot of people think of that as just a fat. There's about 5 grams of fiber in an avocado. And those are prebiotic rich foods. We've got things like acacia fiber, psyllium husk, beans and lentils. There's so many different ways to get this fiber and prebiotics that we need to feed our good bacteria in our gut.
What about, I know you have 2 young kids. What about for people with kids out there? What should they be supplementing with kids?
So typically vitamin D, the kids need that too. Typically omega-3s, they need some good DHA for brain health. That's a big one. And a lot of kids I actually do put on probiotics depending on their pickiness. Sometimes when they become toddlers, getting good veggies and fruits is maybe not the first thing that they always want. So I do like to put them on some probiotics. My daughter, I have on some general immune support this time of year. So there's a unicorn dust, that I will put her on and just mix it with water, put in
What's
a little bit of
unicorn? What do you mean by unicorn dust?
So it's called unicorn dust. It's actually
That's the actual name.
That's the actual name. And they have an immune support supplement for kids, and it tastes like juice. So the kids love it. You mix it with water, and I put a splash of elderberry. And it's a fantastic blend to kind of support their immune system. But even with our kids, like we do stool analysis on kids at very young ages, because we really believe in this root cause medicine world that your gut is the gateway to your health. And so we like to look at their gut, especially if your child has things like really bad seasonal allergies or eczema or ADD and ADHD. We also look at food sensitivity. Sometimes we're giving our kids things that are healthy, but for them are triggering inflammation. So when you start seeing behavioral changes or focus issues, we want to start at a very young age with these principles that we do with adults as well.
There's some really, I'm blanking on the person's name, looking it up, but there's a bunch on how important gut health is. And do you know who I'm talking about? There's a doctor. There's a lot of books on gut health, but there's this one doctor that I think is pretty prolific. It talks about I think he has the Grain Brain book, and I'm blanking on the name now, but someone who's listening can look it up. But he does talk about the kind of the foundation is in gut health. Yep. And I know like heart disease is a huge issue, and from a young kids, even right now, are being diagnosed with high cholesterol, high LDLs. What are some ways that you recommend looking into to lower those?
Mm-hmm. Yeah, and we actually see a lot of high triglycerides in kids, which is really sad, that we're seeing these hyperlipidemias in 10-year-olds, 9-year-olds. We're actually seeing and catching non-alcoholic fatty liver in 13-year-olds. We're seeing a lot of visceral fat. And a lot of times parents think they're doing the right thing. So this is not like, they're just giving them sodas all day long. But we in our culture, our food quality is not good. And so we are getting a lot of high fructose corn syrup still. We're getting a lot of sodas, And these things are really impacting the way our pancreas is making insulin, the way our body is storing fat. So, and I'll go back and answer your question, but we have a hormone called insulin, right? That pushes glucose into our cells. It's thought to be an anabolic hormone. It helps with building. So when kids are really active and adults are really active, this insulin pushes our glucose into our muscles, right? To be used for energy. But we are much more sedentary these days. Children too. We're sitting a lot, and our energy or our carbohydrates and glucose are exceeding what we can fit into our cells. And so instead of pushing our glucose into our muscles, which we want in the active state and moving and getting up and down, we're starting to push it all into our fat cells. And our fat cells are becoming very plump, and we're becoming more inflamed. And we're starting to store this fat even in the very skinny people. We're starting to store this fat around our liver, around our kidneys, and that's called visceral fat. And we're seeing this in children. So what can we do? I think number one, we have to cut out high fructose corn syrup. Like for me, my kids have certain things that I do not agree with them eating, but I realize they're kids, and sometimes they're going to have it. But
I don't know what is in kids' DNA that makes them want mac and cheese. I mean,
I know
it's even from a young age, our kids ate pretty well. We tried to introduce Brussels sprouts and other things, and they would eat them. And they hit a certain age, and they're like, I just want mac and cheese or pizza or whatever it is.
Yes. And the thing I tell parents is like, there are so many ways we can sneak things into these kids' diet. So, one easy swap is like for the kid that loves mac and cheese, could you use Banza noodles, which is made from chickpea flour that has fiber and protein in place of regular white pasta? Like that swap alone, you just gave your child 9 grams of fiber and protein, and they're still eating mac and cheese, So sometimes we have to trick our kids, to get some of these healthier foods. I still really recommend talking about these things at home because we want to instill the principles. We don't want to just sneak. A lot of parents are only sneaking things in. We need to talk about the benefit of eating vegetables and why having too much soda and juice is bad for our health, and why, after Halloween, we need to limit their candy to 1 piece and, maybe have the switch, which I heard, which I love, that takes the candy and puts a toy there, so that they have a little bit of it, but it's not something they're having repeatedly. But I think the biggest thing that we need to do with our kids is remember the same thing. It's moderation. And kids are very, very smart. And so when they start to see behaviors modeled by parents, they want to get involved, is at least what I found in my household. So I make a smoothie every morning. My daughter now wakes up and she wants to help make the smoothie. She's, just turned 2. She's opening our freezer. She's pulling out the frozen avocado, pulling out the frozen bananas. She helps me put everything in. How much spinach do you want to put in the smoothie? She has fun, and she's putting 5 scoops of spinach. I'm like, wow, that's a lot of spinach. You want to keep putting more? She keeps putting more.
Only if you're eating it, she'll keep putting more.
Yeah. No. But she will drink it. So she wants to put it in her little cup. And, it's because she sees us making the smoothies every day, and then she wants to get involved. So as parents, we have to model behavior. But I think the biggest thing is how can we get our kids having some fiber, and how can we keep the high fructose corn syrup out? And how can we remember that, we are designed to move as adults and kids, and how can we get that throughout their day?
So cut out high fructose corn syrup as much as possible, or all of it, more fiber, modeling. So what do you put in your smoothie? I'm always looking for good smoothie recipes.
So we always put a veggie. So sometimes it's frozen cauliflower, sometimes it's spinach, sometimes it's kale, but there's always a vegetable. We always put a healthy fat. So sometimes it's frozen avocado, which we're loving right now because it makes it so smooth. Sometimes it's just almond butter. Sometimes it's a little bit of coconut oil or coconut flakes, but we always have that. And we always add a fiber. So either ground flaxseed, chia seeds, acacia fiber. We keep the fruit lower in the smoothies. So one of the things, and I don't know when this will be released, but fall is like our favorite season. So we lean into fall flavors in our smoothies. So one of our favorite ones is pumpkin spice. So we actually put a little bit of organic canned pumpkin into our smoothie. We put some cinnamon. We put some frozen avocado, spinach, some ground flaxseed, and it tastes like pumpkin pie. And, it's nice and creamy and delicious. And that's very low sugar. I think one of the big problems that I see with my patients is they will tell me what they put in their morning smoothie, and they did a handful of pineapple, a handful of mango, a whole banana. They put 4 strawberries, and before they know it, this thing has, 75 grams of sugar. It's full of nutrients. I'm not denying that fruit is nutritious, but would you sit down and would you eat that much fruit for breakfast? Would you have a whole bowl of mango, a whole bowl of pineapple, a banana, and strawberries before you left? So, we got to think about what would you eat with a meal, and that's what you're putting in your smoothie. So I try to keep fruit at one serving.
And with your smoothie, what kind of liquid do you put into it?
So I really like unsweetened almond milk. So I do almond milk. Sometimes I do full fat coconut milk if I don't have another fat that I'm putting in there. I do like oat milk, but you just have to be careful with some of the additives in these things. Sometimes I just do plain water. Like I'll just mix water in there. Sometimes we'll have organic green juice and throw that in depending on the smoothie. So it really varies, but I think the biggest thing is, some of these milk alternatives have a lot of fillers. And I actually was reading a study last night on gum, which is really it's a fermented fiber. So like when you look at gum, it doesn't seem like by itself, it's a terrible ingredient, but we're actually seeing in people with IBD, there's a study that was just released that it was increasing inflammation in their colon. So, some of these fillers that we have in our milks, especially if you have an inflammatory bowel process, may be more harmful than beneficial.
Anything else from to low for, maybe kids specifically or anyone, lower LDLs, lower triglycerides, anything else for kids as far as increased fiber, cut out high fructose, healthy, you mentioned try and get the veggie, the healthy fat, and then the fiber. Anything else that people should think about?
So we actually will supplement plant sterols as a supplement that we'll use to help lower lipids in children. We may also do some low dose niacin, depending on what's going on with the kid and what age. We will also supplement fish oil. So there are some things we do from a supplement standpoint. Bergamot is actually another thing that's citrus that can really lower lipids. So it just depends on the kid's age, the size, and kind of what their baseline is. If someone comes into me and they're doing high fructose corn syrup, the kid's able to have juice and soda, every single day, we're going to just focus on lifestyle first and recheck. If they're doing all the right things and, we see a genetic, sometimes there is a familial hyperlipidemia and my patients really are doing the right things. We'll start pulling in plant sterols. We may start adding in some liver support, things like silymarin or milk thistle to help. We'll probably do a stool test and just see, is there anything going on with the gut microbiome that may be impacting lipid metabolism? And the other really big thing that we catch a lot is if you are doing all the right things, your child may have a thyroid issue because we know that thyroid plays a role with lipid metabolism. And so I have found a lot of my patients with high lipids, when I check their TSH, they're at like 4.8, which is actually a true hypothyroidism. And once you get their thyroid doing better, they are able to break down their lipids more effectively. So, even when we're talking about lipids, it's not always exercise more, eat less, get more fiber. We've got to look at the whole picture, your gut microbiome, your liver health, thyroid function.
And this goes into, stat wellness in your model, because I love, if medicine, right? And it has its place in a lot of things for sick care, but for wellness care, from my experience going to the doctor and my kids going to the doctor, there's, they have an issue. Let's just watch and wait. There's no advice. There's no feedback. There's no protocol, and it's also very compartmentalized. And they're not looking at the holistic person. And so I love your model of wellness, which it looks at the whole person, the whole body. It looks at the data as far as what, blood work. It looks at their, their body type and other metrics. So when someone comes in and gets assessed, what are all the things that you look at?
But I wanted to share like two really, really quick patients for exactly what you're talking about that get my blood boiling. Is I have the patient that comes in that was told they have Hashimoto's and that there's nothing they can do for their Hashimoto's. And they just every year need to check their thyroid and increase their medication based on their level. That just like breaks my heart because there's so much you can do for Hashimoto's to get to the root cause of the immune and inflammatory issues. And so that is a perfect example. Or the patient that has a positive ANA, but they're not sick enough for biologics. An ANA is anti-nuclear antibody that looks for autoimmune disease. And so somebody may have a positive ANA and some vague symptoms. They feel a little stiff in the morning, their joints hurt. They go in, they get a full assessment. your joints are looking okay right now. Why don't you come back next year and we'll see how your joints are doing and we can figure out when to start a biologic. Again, those patients, exactly to your point, they just break my heart because this is a warning sign. This positive ANA is a warning sign that autoimmune is going to worsen if we don't make changes. So those are just like two quick examples that came into my mind as you talked about these patients that are just told, like, let's watch. But to answer your question of like what we do, so when you come in as a new patient, everybody gets a body scan. We don't care about the weight on the scale at all. The number on the scale is not a good indicator of your health outcomes at all. So that we don't care about. We don't even talk about the number on the scale. We talk about your composition. So we spend time talking about what is your muscle mass? How is your symmetry? What is your hydration? Where is your water sitting? Is it outside your cell? Is it inside your cell? Where is your visceral fat, that deep, dangerous fat that we know is correlated with diabetes, strokes, and heart disease? So those are the markers that we want to see. And those are the markers we want to track, not the number on the scale. So we do that. We do have some patients, we're very mindful. We ask them, are you okay to see the number on the scale? Some of our patients come in and they're like, no, it impacts my day. The number on the scale impacts my mental health. So we cover up the screen. We look at the data points. We talk about their composition. We put it in their chart and we never tell them the number on the scale. I think that's really important. So we ask all of our patients that. And then we dig into their health timeline. So then the next hour is spent talking about every single thing that you've been through throughout your life, when your symptoms started, what was going on in your life, what was your living conditions, where were you living? And then we get into today. Tell me about what a day in the life of you looks like today. What time do you wake up? What time do you eat? What kind of things are you eating? How do you feel throughout the day? Do you want to take a nap at 3:00? Are you feeling tired and wired at night? We get into their whole history, and then we get into today, what does the day in the life look like? And then that helps us uncover what labs we should run. We don't even run the same labs on everybody. So you may come in and through your history, I'm like, okay, you've been on a lot of antibiotics. You're dealing with some skin rashes. You're bloated. You crave sugar. You have brain fog. I'm going to run some yeast markers on you. I may not run that on the person I see right after you. Or somebody may come in and everything is so inflammatory. They're having migratory joint pain. They're having fevers out of the blue. I may do further autoimmune testing and I may look at how their immune system as a whole is doing or see if I can see signs of co-infection. So it's very individualized.
This is awesome. Do you do virtual?
We do. So we do virtual if our patients.
Because if someone's listening to this and they're like, yeah, this sounds amazing, but you have locations in Georgia right now. Wait till the state come towards you. How does it work virtually?
So we work with patients virtually as what we call a consultant on their health. If we're not licensed in your state, we actually medically can't make recommendations. It's tightly regulated. It's a little bit better post-COVID, but we couldn't prescribe anything for you. And then if we do make recommendations from a lifestyle or supplement standpoint, we have a little clause, you need to have a local primary care, make sure it's fine for you to do this. So we work with patients as a consultant, but we actually do have a lot of patients that come into our office from out of state to establish the medical relationship. So then we are able to prescribe and recommend. And then we recommend that you come once a year, and then we can do telemedicine all in between. So those are kind of two options. Some people are like, I just want to hear like what you would recommend. What are some things that you hear from our history? That's the consulting part. I really recommend that you further assess your gut. I think you need a stool test, all of those situations.
Yeah. So if it's virtual, you may have a consultation and then recommend they get certain testing done locally, and then they send you the results of that.
Yes, exactly. Yeah. And there's certain things that, patients, they'll be like, we use LDN, for example, low dose naltrexone to help with the immune and inflammatory cascade. Some of our patients have gone to their primary care. Their primary care is like, you know what? I don't know if this is going to work or not, but I'm happy to prescribe it. This is the dose you recommended. Here's the prescription. Let's see how you do. Others are like, nobody locally is going to prescribe this. I looked into it. I hear what you're saying. I want to come to Atlanta and see you guys. And I want you to then prescribe the LDN. So sometimes we work a little bit backwards. Like we start as a consultant and at some point they're like, I trust what you have to say so much and I can't find a local provider. I'm willing to come in town. And then hopefully, we're going to be nationwide and then that won't be an issue. That's our goal.
Exactly. We were talking earlier. It's funny because you have it sitting here. I always like trying out new stuff. So a few recommendations, but I just actually got this, which is like, It's I don't know. I've never tried it. I haven't tried it yet, but it's a mango peach smoothie flavor of omega-3s because I hate the taste of fish oil. So I like to get the flavored one. So, but you were talking about before we hit record, there's a lot of people with gut health issues, right? And specifically, Crohn's, IBS, and we'll call them Gabby because I know you can't share exactly the person, but what happened with her?
So Gabby, she is one of my favorite patients. She struggled with Crohn's for over 20 years. She actually had traveled all over the nation. She had been a part of multiple research studies and she was treatment resistant. Her Crohn's disease, they were telling her there was nothing that they could do for her. She was losing weight. Her joints were starting to hurt. She couldn't even go for bike rides with her husband because she'd have to stop and use the bathroom. She'd have 20 bowel movements a day when she came to us and didn't feel like we'd be able to help her, honestly. She was like, I'm just here. I have no thought that you're going to be able to help me, but I'm here and I'd like to hear what you have to say. I've tried everything and I'm at a breaking point. So we did a stool test. We did blood work. We found in the stool test, she was lacking so much of the good bacteria. And we found that there was significant amounts of inflammation based on a marker called calprotectin. Calprotectin is a marker that helps us say, do you have IBS, an irritable bowel syndrome, or an inflammatory bowel process? So we love the marker calprotectin so that we can see, do we need to scope and actually see the lining of your gut? Because we, just like you said, value medicine. And if our patients have inflammatory bowel, we need to actually look at their colon. In her case, she had colonoscopies about every year she's getting them, and her inflammation's through the roof. So we basically did two very simple things. I put her on SBI Protect, which is it's a product by Orthomolecular. It's immunoglobulin therapy from cattle's bloodstream. And what it does is it helps heal the gut. We actually did three things. So I put her on SBI Protect. I put her on what's called BPC 157, which is actually peptide therapy. It stands for Body Protection Compound. She opened it up and put it in her water with the SBI Protect. And we started her on low dose naltrexone at night. Those are the three things that I did. And she came back in 8 weeks and she was riding bikes with her husband. Her energy was better. She was down to about 4 bowel movements a day. Her gastroenterologist was like, I don't understand how this stuff is working this way, but keep doing whatever Kristin says to do. Keep doing it. And that for me was just such a good moment when this person was treatment resistant and it was not these crazy things we needed to do. Her diet was already on point. I mean, she had done the, low FODMAP. She had done the specific carbohydrate diet. She had done gluten-free and dairy-free and no sugar and all these things. But just looking at her gut, getting those good bacteria up, which we didn't even actually do until phase 2, because sometimes when they're lacking all of the good bacteria and they have a lot of dysbiosis, and all that term needs is an imbalance of good and bad bacteria, sometimes you have to calm the inflammation and get the gut lining a little bit stronger first before you just pile on probiotics, because they may feel more bloated, more discomfort. And so at 8 weeks, she was doing a lot better. We then added in some really good, strong probiotics, and she continued to have improvement. She's still not 100%, but the fact that we've been able to cut her calprotectin in half, we've been able to bring her bowel movements from 20 bowel movements a day to 4. She feels like she's a human. She has strength. She's putting weight on. These are our perfect example of how functional medicine and really working on the healing and the pathophysiology of what's going on can make a huge difference.
Let's talk about menopause.
Yeah.
Right. I'm sure that's common too.
Oh, yes. So one of my favorite stories about menopause is I had a woman who was an executive, very, very high performer. She's been an executive her whole entire life. And she's starting to feel like she's not remembering things. It's taking her longer to complete a task. She's starting to feel more overwhelmed with stress. She's having sleep issues for the first time in her life. She's at lunch and literally forgetting the person's name. She's like, what is your name? I'm starting to get really worried. So she goes in, her primary care says that she probably needs a psychiatrist. She's been under a lot of stress as an executive. Psychiatrist diagnosed her with adult onset ADD and ADHD, wants to put her on a stimulant. She doesn't want to take a stimulant for the rest of her life. Why? I'm 51. I've had the same level of stress, the same position for 20 years. Why now do I have adult onset ADD and ADHD? This just blows my mind that these are real stories, by the way, real stories where the solution is a stimulant for the rest of your life. So she comes into us. When was your last menstrual cycle? It started to become irregular at 49. She's just now hit 1 year without a menstrual cycle. The average in the United States is 51. She's kind of right on track with that. You are perimenopausal until it's been 1 full year without a cycle. She hit it. We look at her hormones. She is so depleted. Her progesterone is less than 0.01. She has no progesterone in her body. All we did was start her on some progesterone at night. She came back for a follow-up at 8 weeks. Her progesterone was only up to 1.5, which in menopause, we like it above 1. And she goes, Kristin, my brain health is better. My sleep is better. I feel less overwhelmed with stress. And all I put her on was progesterone 50 milligrams, a low dose too of progesterone at night. Oral capsule helps the most with sleep. And that is another perfect example of, understanding the root cause of what's happening. And if she were to go the route of the rest of her life taking stimulants, what would that have done? And there's not anything wrong with stimulants when needed, but understanding the root cause for her, this was not an adult onset ADD and ADHD. And stimulants were going to suppress her appetite. They could make her have a lot of ups and downs, could make her feel more emotional, could increase her cortisol more, which we already know her cortisol is high because she has no progesterone, she's not sleeping, and she's overwhelmed. So, what all is in her stress bucket? And that stimulant could have just tipped her. Where for us, we were working on calming and relaxing and improving that brain health.
Kristin, I have one last question. And before we get to it, I just want to tell people, check out statwellness.com, everything they're working on there. Check out more episodes of inspiredinsider.com. Last question is, managing work, business, and kids.
Yeah.
What do you do? How do you do it all?
Yeah. And I know we were talking about this before, and I am a person that has always worked, even when I don't need to work. I worked at Einstein Bagels at 5 a.m. before high school. My dad was like, why are you working at Einstein Bagels? You made $10 this morning before you go to high school. So, I want to preface this by saying part of this is deeply embedded in me, this entrepreneurship and this grit that I thrive, on a full plate. And I do test my adrenals all the time. I do saliva hormone test. I do blood work every 3 months. So I make sure my body is handling the stress appropriately, which I think is really important. But to answer your question about how you do it all, kids, business, you don't. The answer is you don't do it all. You can't possibly do it all. Something is going to not be 100%. And we know that. And it changes depending on the season. So the thing that I talk about with my patients and that I live by myself is I always have a couple non-negotiables, no matter how busy my season of life is. I have some very, very basic things that in the busiest of the worst of the busiest days, I will still do. And some of the most basic things that I do is I drink 16 ounces of water first thing in the morning. Like I know I'm waking up dehydrated. I know water gives me energy. It fuels my brain every single morning, no matter how crazy it is. I'm drinking 16 ounces of water. I also start in my day with 4 super slow, deep breaths. No matter what happens, I have a minute to do slow, deep breathing every morning and every night. It's the way I ground myself. It kind of calms me down from the craziness. And it's something that I can consistently do. So that's a big thing. And the other thing is actually something I've had to train myself over the last 2 years of becoming a mom is, to me, I was a marathon runner. I was a strength training coach. I was a personal trainer. When I exercised for 45 minutes to 60 minutes. That's what my workout was. I can't fit in 45 or 60 minutes. And so for a while, I just didn't exercise. I realized I was like, okay, I'm going to eat really clean. I'm going to drink my water. I'm going to do my breathing. I'm going to prioritize sleep, but I just can't exercise. I can't fit it in. And then I realized I coach my patients through this all the time. Exercise does not have to be 45 to 60 minutes, right? So we got some equipment in our basement and I realized all I needed was 10 minutes. I chose 3 exercises. So this is what I do now is I pick 3 exercises that I'm going to do and I do each one for a minute and I do 3 rounds. That's 9 minutes. And then I do 1 minute of stretching and deep breathing. And that is my 10 minutes. And I move for 10 minutes a day. And that is what I can commit to in my non-negotiable. If I have a good day and I can do a 45-minute workout, that is amazing. And I feel so happy about it. But this all or nothing, it doesn't work, right? It just does not work. And I got quickly into that trap. And so big things for me, 10 minutes of movement a day. And surprisingly, I'm sore. If I have a high kettlebell and I'm doing kettlebell deadlifts, doing a minute of that 3 times, like you will feel it in your glute and your hamstring. That was 3 minutes. That's it. So that water every morning and deep breathing, those are my non-negotiables. And then the other big thing from a business perspective is tackle the top priority first thing in the morning. Don't do the easy tasks that you want to check off. Don't, spend all this time going through all of your emails and adding to your to-do list. what is the one thing that you have to get done before you go to sleep that night? Do that first, because then you can go to sleep that night, right? That was the other thing, like the really big things. I am an achiever. I love checking things off my list. So I would be like, okay, knock off all the things I can, put these check marks in and feel really good. But then the thing that took the most brain power, and that was my top priority, I was putting off. And then the kids go to bed and then I'm staying up late doing this thing I had to do rather than flipping it around. So, basic things, but I think don't tell yourself that you're going to do everything perfectly the way you want to do it when you're doing all the things, because you can't. But what are your non-negotiables? What can you commit to on the most busy day to always do for yourself? And then anything you do beyond that is excellent and awesome, but you did your non-negotiable. And then tackle the biggest task first, and then you can go to sleep.
Love that. There's a book I listened to a long time ago, Eat That Frog by Brian Tracy,
Yes.
who he talks about exactly that. You got to eat that frog first thing in the morning. Do what is going to be the most difficult. Dr. Kristin, thank you. Thank you so much. I could listen to you on and on and on for hours about different conditions, but everyone should check out statwellness.com, check out more episodes of inspiredinsider.com, and we'll see you next time.
Thank you so much for having me on.
Thanks for listening to the Rising Entrepreneurs Podcast. This episode is powered by Rise 25. Please subscribe and check out future episodes.